Hello and welcome. This is an update to the CMS and Joint Commission requirements for procedural sedation. As part of these requirements, you'll find that most of our documentation will be done on paper instead of in Cerner. However, a few things, including the ordering of the sedation and the procedural discharge and sedation discharge instructions, will come from Cerner. So what are these requirements for physicians? Well, our specific requirements are that we have to obtain the consent for the level of sedation, and this is on paper, and we do deep, moderate, and minimal sedation. We choose that and discuss it with the patient. We have to obtain the consent for the procedure. This is also on paper. We need to order the equipment and drugs to the bedside along with the nursing monitoring parameters. Now this is available electronically in Cerner, and I'll talk about how we can do that. We must complete a pre-sedation assessment, and there are specific requirements that we have to complete, including the Malapati, the ASA classification, previous problems with anesthetics. All of this is on a paper form that we've developed. We have to participate in the timeout, the universal protocol. The nurses document this, and there's a form for this, but we participate in it. And then this also has a post-procedure timeout. Again, we participate, but the nurses document this. We have to complete a post-sedation note. Now, there's specific CMS requirements for this, and we've created a form that allows us to document this. The procedure note itself is documented in Cerner, or electronically via Cerner. Now, the nurses have a paper form where they document the intra-procedure sedation, and we can give verbal orders, and then we sign this form as a verification of the order post-procedure. Now, we do not have to order each specific medicine, but we have to order the initial medicines to be at bedside. And again, we have to discharge the patient with both the procedure that they had instructions, as well as sedation instructions. Currently, the CPOE that we have does not allow us to document in the way that the Joint Commission and CMS require, specifically that we have a separate date and timed pre and post sedation note. So what we've done is developed some paper forms to allow us to complete these things. We've created a paper sedation pre and post assessment form. We adopted a paper sedation flow chart for the nursing. We have a paper form for pre-procedural timeout, and we've put this all together into a folder. So let's look at some of these forms. One of the first forms is the emergency department procedural sedation consent form. Now you'll have the top part, and this has to be completed by the physician. The first part has the procedure in layman's terms, and then below that it has sedation by a non-anesthesiologist, and the plan can be for deep sedation. I know this is confusing to the nurses, but we do deep and are credentialed to do deep sedation. And the next page of the consent form has specific emergency department procedures such as dislocation or fracture reductions, and this again has to be completed by the physician. Any procedure which has sedation must also have a consent for the procedure. And here's the back page of the consent form. All procedures also have to have a consent for blood products. I tell patients that I've never had to give blood for shoulder dislocation, but we're required to ask. The physician also has to date and time and sign with their number this consent. Next, we're going to talk about the sedation pre and post assessment. The key thing about this is that all the blanks have to be filled out, and the pre-sedation assessment must be done, signed, timed, and done before the procedure and sedation itself. So here's the form we've created to document the pre and post sedation assessment. So everything that's on the left side of this column has to be completed before the sedation and procedure take place, including last meal, preparation, Malapati score, airway, a physical exam, ASA classification, previous difficulties with anesthesia, and we have to sign, date, and time this prior to the procedure. In the second column are the post-sedation documentation requirements. Now these come right out of CMS's requirements for sedation. Specifically, we have to write all the vital signs, including the temperature, in here. Everything in this column needs to be filled out, signed, dated, and timed by the physician. The procedure itself, such as a shoulder dislocation, is documented under a procedure note in Cerner electronically. So what else do we do electronically? Well, we have to order the meds to the bedside, as well as the monitoring parameters, and when they can be discharged from sedation observation. So these are in the CPOE. They're currently being built for the emergency department, but right now you can find them under my shared folder. If you look at Freemeyer and then look under my shared at sedation, the ordering parameters as well as drugs are available there. You can also find these in the critical care BHS shared folder under moderate sedation. This is a misnomer because we do procedural sedation, often deep. However, this is another place where you can find the orders. All medications that are given by verbal order during the sedation must be authenticated by the physician post-sedation, and we've created a form with a physician's signature on that. Finally, all patients that receive procedural sedation should be discharged home with sedation instructions as well as the procedure-specific instructions. These are both available electronically in Cerner CPOE. So how do you find sedation discharge instructions in Cerner? They won't come up automatically, so you'll have to go and click the tab that says All in the right upper hand corner, then type in sedation in the search area. And once that comes up, you'll find the options for moderate conscious sedation, adult and pediatric. Again, this is a misnomer because we do procedural, usually deep, unconscious sedation, but every patient has to be discharged home with sedation discharge instructions, and these are how you find them. Thanks for your attention, and I hope this is helpful. Please let me know if you have any questions, and I'll leave the requirements up for you to look at as a final reminder. Thank you.